The goniometer is a protractor, sometimes supplied with a level gauge, and two arms that measure the angle, with a scale to record the range of motion. The shoulder joint. Lateral rotation. Lateral rotation is measured from 0 down, forwards and up. Use the shoulder joint as a central reference. Measure off on the scale. The norm is about 170 degrees. Hyperextension of the shoulder joint. This is measured in degrees of backward flexion. Again, use the shoulder joint as the reference. The normal angle of hyperextension is around 50 degrees. Flexion and hyperextension of the hip joint. Flexion is measured from the horizontal neutral position vertically up without lifting the hips from the floor. Use the hip joint as a reference point to measure this hip flexion, which should be about 110 degrees. Hyperextension of the hip is measured from the neutral line backwards. Again, use the hip joint as a reference. Normal hyperextension is around 20 degrees. A goniometer can be used to measure wrist flexion and hyperextension, and radial and ulnar flexion as well.